Well, just days after a shooting at Aultman Hospital in Canton that left one employee injured, healthcare workers are speaking publicly about the growing violence they face on the job.
A recent study by National Nurses United found an alarming 8 out of 10 healthcare workers face violence at work, and as a result, they are more than 4 times as likely to be injured by workplace violence than workers in all other industries combined.
Well, News 5's Nadine Abusada joins us live with more on this issue. And Nadine, healthcare workers say it's getting worse.
Yeah, Mike and Tiffany, in these situations, workplace violence is usually one of 3 things: physical, verbal, or things like scratches or pinches. They say since the pandemic, they have seen a major increase, adding that legislation simply isn't enough to stop it.
This doesn't happen in other workplaces. People wouldn't tolerate this.
Rick Lucas is a registered nurse and the president and executive director of the Ohio Nurses Association.
It's really unavoidable. I've had people get in my face, threaten to kill me.
He tells News 5 violence and attacks inside hospitals have become a serious problem.
We're talking about people being bitten, spit on, throwing a urinal at them, throwing stool at them, punching them. We had somebody that was beat on and dragged around by her ankles. This is not normal.
In Canton, a man is facing charges after taking a gun from a security guard and firing it at the staff at Aultman Hospital.
One of our attacks was shot.
One employee was injured.
From the staff that we heard from, they didn't follow their protocol and have an overhead announcement that there was a code silver, that there's somebody with a firearm.
In a statement to News 5, Aultman Health says that at Aultman, the safety and security of our patients, visitors, and colleagues is our highest priority. We are doing everything we can to care for a member of our Aultman family who was struck by a bullet in the line of duty at Aultman Hospital. According to Census, healthcare workers make up just 10% of the U.S. workforce, but they experience 48% of all reported non-fatal workplace violence injuries. Rick says there are several reasons why that number is so high, including growing unrest in society and healthcare being politicized.
Unfortunately, we have elected leaders out undermining science, and that undermines the trust in us as professionals as they push these, wild conspiracy theories, and it erodes the trust and it increases violence.
Adding that many incidents aren't reported because of fear of repercussions.
It's not always safe to report violence. Sometimes we're threatened by hospital administrators with discipline for reporting.
Some hospitals are beginning to act. Cleveland Clinic recently announced a Center for Workplace Violence Prevention and Caregiver Well-Being. But Rick says more needs to be done, both at the hospital level and through legislation.
We need there to be strong policies in place to also curb and deter the violence, but we need protocols and preventative measures to mitigate harm.
Because in a place where their job is to care for patients, violence shouldn't be a concern.
We don't wear body armor. We're not trained in hand-to-hand combat. We're caring professionals, and so it's not in our nature to fight back.
Now, as of April 9th, the Healthcare Workplace Safety Act did go into effect. This requires hospitals to create a security plan, but also an incident reporting system. Rick sees this as a win, but he sees the solution also as a multi-pronged approach. So though there's legislation that has been passed, he still wants to see more done. Guys?